Aortic valve repair is a procedure that would be considered open heart surgery. In order to do the operation, we connect the patient to a heart-lung bypass machine. Usually this is done through an incision in the middle of the chest called a sternotomy through the breastbone. And many times this operation can be done through a small version of that incision, just through a portion of the breastbone. Once on the heart-lung machine, we stop the heart from beating so that we can see and work on the heart while it's not moving. During that time, you're supported by the heart-lung machine. We would open the aorta to get a good look at the valve and assess whether the valve is repairable and what needs to be done. In most cases, the repair involves placing an artificial ring, something called an annuloplasty ring, to support the repair, and then the leaflets or flaps of tissue are repaired with a variety of sutures. The whole operation usually takes 3 hours or so. It may take a little longer. Most patients spend overnight in the intensive care unit and then about 3 or 4 days in the hospital. We have done a small number of these operations without splitting the breastbone using a robotic approach, and we feel that this is a very promising way to do aortic valve repairs.